Well, good evening. You're a very responsive group. I love people like you. Listen, I am very, very happy to be here tonight to help introduce Rebecca Schamberg's remarkable documentary, Do No Harm. I've already seen it, so I know it's great. Mark Twain, you've all heard this, Mark Twain once famously remarked that truth is stranger than fiction. And tonight, you will be reminded of just how wise Mark Twain was. I think you'll find that the events recorded in this film almost sound like the plot of a bestseller by John Grisham. In a small Georgia town, two middle-aged professionals discover shocking information about corrupt practices by powerful business interests. They suffer outrageous attacks and threats intended to intimidate them as they struggle to bring the corruption to light and justice to uninsured patients. And then they throw in several flamboyant Southern lawyers and offshore bank accounts just for good measure. This story is, sadly, all true, and it is in no way fiction. But it helps focus our attention not only on the plight of the uninsured, but also on some of the factors lurking behind that plight. Even before I became the Attorney General, I was troubled by the large number of Americans who are uninsured. In Illinois, that number is currently estimated to be at least 1.8 million, and we know that it is increasing every single day because of our struggling economy. I was also troubled by the fact that the uninsured were asked to pay the highest prices for health care services, whereas people with coverage receive steep discounts from hospital prices. In the absence of laws to protect healthcare consumers from overly aggressive billing and collection practices, many Illinois hospitals employed strategies similar to those of Phoebe Putney that you're about to see tonight. So since becoming the Attorney General, my office has worked tirelessly on these issues with many of the people who are here tonight. And we've done that through litigation, investigation, as well as legislation. Our lawsuit, one that is receiving much national attention, Provena Covenant Medical Center versus the Department of Revenue, is currently pending before the Illinois Supreme Court. And what the case addresses is a hospital's right to a property tax exemption in the face of a charity care rate that is 0.7% of net patient revenue, so less than 1%. In 2003, we launched an investigation concerning pricing, billing and collections in charity care practices in nonprofit hospitals under the Illinois Consumer Fraud Act. Several hospitals have suggested that the investigation was an important catalyst for change here in Illinois. Moreover, the investigation provided us with invaluable information that allowed us to change the law here in Illinois. In 2006, our legislative proposal to address the amount of charity care necessary to justify a charitable tax exemption did not pass. However, that year we were able to negotiate with the Hospital Association to pass the Hospital Fair Patient Billing Act. So now, here in Illinois, the law requires hospitals to tell healthcare consumers that financial aid may be available and to provide them with detailed and complete pricing information. In addition, here in Illinois, before a hospital may pursue collection actions against an uninsured patient, the hospital must give that patient the opportunity to verify the accuracy of the bill, apply for the hospital's financial assistance program, and avail themselves of a reasonable payment plan. All of these changes work toward the greater goals that I presume everybody in this room shares, and those are the goals of greater access, greater coverage, and greater affordability. I am especially proud that Phyllis was kind enough to mention that last year, again, after very tough negotiations with the Illinois Hospital Association, the legislature unanimously passed the Hospital Uninsured Patient Discount Act. Now, Illinois hospitals are required to limit their charges to the uninsured to an amount that equals the hospital's costs plus 35%. And this stands in stark contrast to what hospitals were charging the uninsured before the law went into effect. On average, 250% above actual cost. So, It's a good thing here. So now the uninsured will be charged prices that are similar to those of us who are lucky enough to have health care coverage. Another important feature, in order to prevent and in order to reduce the unbelievable number of Americans who end up in bankruptcy because of medical costs, and it's estimated that as many as 50% of people who end up in bankruptcy in our country end up there because of medical costs, we put a cap on the total amount a hospital can collect in any 12-month period to 25% of the patient's family income. Thanks. This law is unfortunately one of only a handful like it in the country, and it is by far the most generous in terms of eligibility. So I know that we all have very high hopes that as the Obama administration addresses health care reform this year, that a comprehensive approach to the problems that uninsured persons face will in fact result. Senator Charles Grassley, who appears in Do Not Harm or Do No Harm, and others on the Senate Finance Committee continue to advocate that national health care reform should include a clear connection between a hospital's tax status and its provision of charity care. Do No Harm, in addition to telling a very compelling story about two courageous whistleblowers that chose to do what's right at great personal cost, provides compelling evidence about the need for reform. I expect that you will enjoy the film as much as I did, and I expect that it will lead you to become leaders, to the extent you haven't already, in the call for reform here in the United States of our healthcare system. Thank you very much, and pass the popcorn.